12 people in America die from a smoking-related illness. Throughout the presentation, my brother Tyler will be drawing stick figures to symbolize people dying in America every minute. These are my sources that give me credibility on all this knowledge. These are my 3 main points: health effects of tobacco and nicotine addiction, can we do something about this, and call to action, just say no. Approximately 43 million people smoke in the United States. Cigarettes are the leading cause of preventable death in the U.S., which amounts to about 1 in every 5 deaths in America. Smoking kills more people than alcohol, AIDS, car accidents, illegal drugs, murders, and suicides combined, with thousands more dying from spit tobacco use. In addition, smokers lose an average of 13 to 14 years of life because of their smoking. Some health effects of smoking and tobacco use are cancers, which is the most common. The types of cancers you can get are lung, kidney, cancer of the larynx, head, neck, and breast cancer, bladder cancer, stomach, cancer of the esophagus, and of the pancreas. You can have problems with your lungs, which include chronic obstructive pulmonary disease, COPD, also emphysema and chronic bronchitis. You can also have problems with your heart, cardiovascular, which is heart disease, heart attack, stroke, atherosclerosis, I can't read that, peripheral vascular disease as well. You can have renal failure as well as chronic kidney disease. You can have oral infections from mostly spit tobacco. You can also be more susceptible to normal infections such as the flu, the common cold, tuberculosis, and pneumonia. It's very proven that smoking leads to infertility. 60% chance of being infertile than non-smokers. It also has psychological effects. It leads to stress and social and behavioral issues in your life. Another health effect is cognitive functioning. It leads to Alzheimer's, schizophrenia, Parkinson's, and depression. When you have a nicotine addiction, it's defined as the state of being enslaved to a habit or practice or to something that's psychologically or physically habit-forming, to such an extent that its cessation causes severe trauma. This basically implies that your body thinks that it needs the nicotine and it starts shutting down because it doesn't have it. Modern research shows that nicotine acts on the brain to produce a number of effects. Specifically, research examining its addictive nature has been found to show that nicotine activates the mesolimbic pathway, which is the reward system, which basically means that it regulates the feelings of pleasure and euphoria in your head. So your mind thinks that it's a good thing. So if you want to quit, how do you quit? There are nicotine patches, nicotine gum, chewing normal gum. A lot of smokers complain of the hand-to-mouth habit, and a lot of people do gain weight if they quit smoking because they're used to constantly putting their hand up to their mouth to smoke. So it's recommended that you eat celery, not eat toothpicks, but use toothpicks or eat celery. Another big thing is distracting yourself. You can see a movie, you can clean, you can be around friends, especially the ones who don't smoke. You can go shopping, you can work out. There's multiple things that you can do instead of smoking. Another big one is drinking plenty of fluids. You should do this no matter what because it's good for you, but also keeping your body hydrated minimizes the effects of the nicotine withdrawal. If someone stops smoking, these chances are gradually decreased as the damage to your body is repaired. A year after quitting, the risk of contracting heart disease is half that of a continuing smoker. Can we do something? There have been smoking bans in the United States in different places. In Pueblo, Colorado, they instituted a public smoking ban in 2003. The number of heart attacks has dropped by 41% from 18 months prior to the ban and 18 months after the ban, according to the Centers for Disease Control. The state of Massachusetts has also reported similar results since enacting a smoking ban in 2004, with a 30% decline in heart attack deaths since that time. This is basically saying that because of the smoking bans, there have been decreased smoking-related deaths, which is extremely important. What if we do nothing? Well, there has been a decrease in the number of smokers over the past decades. If you look at the 50s and 60s, it's all over the TVs. All these people smoke all the time, and it's actually decreased since then until now. But it's believed that more than 6 million of kids alive today under the age of 18 will die of smoking if the rate of smoking does not continue to decrease like it has been doing. So if it goes back up, or if it just goes to a standstill, it's possible that 6 million people alive today will die from smoking. Continuing on to what if we do nothing. Don't know why that was double, but there's a picture on this side, and it's just basically saying I can increase irritability, impatience, hostility, anxiety, depressed mood, difficulty concentrating, restlessness, decreased heart rate, and appetite or weight gain. So, do you just want to die? The answer is no. We want to live and live healthy. Remind the people in your life that smoke does kill people around you as well as yourself. On average, smokers die 13 to 14 years earlier than non-smokers. If you can remember back to where you were 13 years old, imagine if all those years were erased because you were smoking and you died. That's what would happen if you continued smoking. My call to action is that every single person has the right to live out their lives in whatever way they choose with their freedoms they are allowed by the Constitution. But when their addiction to tobacco adversely affects the health of others around them, action needs to be taken. Stand up for what is right and make the world a healthier place to live. Thank you. She has to get her faces again. Don't end it. Actually, this is how many people have died while I was giving my speech. So, the end.